Labour leader Sir Keir Starmer says he's sceptical about whether the government actually has a plan to control the virus.
But his party is still expected to support the three-tier restrictions when they are debated in the Commons later on today. So let's talk to the Shadow Health Secretary, Jon Ashworth, who joins us now from Westminster. These are very severe restrictions in the top tier for Liverpool. Are you backing them?
Yeah, we are actually, because look, we know we've got to reduce social interactions. We know we've got to reduce mixing. I mean, if they'd have fixed the testing and the tracing system, we could have perhaps avoided this. I mean, we complained about testing and tracing for months. Scientists did. You did on your show. They didn't listen to us. And now we're in the situation where the virus is getting out of control. And I'm sad to say we do need tougher restrictions to try and squash it down.
Even the Chief Medical Officer says that those toughest of restrictions, the top tier, are not going to be enough. So there is an argument, isn't there, that actually the government should have gone further, and also that this, I mean, you know, nobody wants a lockdown, but that tougher restrictions should be introduced for more areas.
Well, to be frank, I think they should go further. And look, we're not going to vote against the restrictions today because they're better than nothing, you know. And if we defeated them, there'd be no restrictions. So that's the way the parliamentary vote works today. But I actually think they probably should go further. I don't want to see. Look, I know that closing pubs and bars is going to have a huge economic implications, and the government needs to step in with support for those businesses affected. I don't think the support on offer is enough, and the government needs to go further.
Well, the thing we learned, didn't we, last time, is that what lockdown does, it does suppress the virus in a very effective way for a period of time that ought to buy you enough time, as the World Health Organization has said this week, to then get your testing ducks in a row and get it to sort out so you don't have to keep doing lockdowns. The problem is we don't have that. And there are two residual effects of these lockdowns. One is the appalling economic strife that it causes. And secondly, the secondary public health crisis it causes in not have people who have cancer, heart disease and so on, not getting treatment. If we're going to go back into lockdowns now, those two things have to be protected. You've got to protect people who are losing their jobs, and you've got to make sure that people that have other problems outside of COVID get the treatment they need. Their lives are as important as anyone who has COVID.
Totally agree with you. You are absolutely spot on. I mean, we've now got a situation where there are 111,000 people waiting beyond a year for treatment. Back in January, that was 1,600. That is the scale of the deterioration in people waiting for treatment in the NHS. So we cannot have another situation where all the operations are cancelled, people who have got cancer have their treatment delayed. We've got to protect the NHS. The other thing I would add, though, to your 2 points about the NHS and the economy, the third point I would add, Piers, is supporting children. I think we've got to keep our children in school as long as we possibly can. The impact of taking children out of school is going to be devastating for their life chances.
That is the one thing that the government seems absolutely adamant about, that there is a commitment to keeping children in education. There is an issue, though, isn't there, around university students? So much of this seems to be driven by, in the large part, asymptomatic students at university who are testing, in some cases, in their hundreds, but are also suffering because all of their lectures are online, but they're in university accommodation and in a sort of series of, you know, rolling isolation weeks. I mean, what should the government do about university education?
Well, I mean, we're in a bit of a mess now on universities, aren't we? So, you know, because they should have probably shifted it all to online, but now you've got students who have travelled to mainly the big cities and are living in city centre halls of residence. They probably need to stay there. But look, the big increase in infection rates in northern cities and towns isn't just because of university students. Their infection, the embers were glowing brightly across the summer, across the north, if you like, and they didn't put in place the testing and tracing that is needed. And as Piers said a second ago, look, if you're going to impose more restrictions on people, which is going to be tough for people, and people have already made tremendous sacrifices, then in return the government have really got to fix this test, trace and isolate system. I just don't understand why they insist on giving all the contracts to firms like Serco and Deloitte
so
when the local public health experts should be doing it.
As the opposition, why don't you make that the deal breaker? Why don't you say, we will support these new restrictions, but in return, You need to either give the testing, track and tracing to local public health teams, or you need to sort out a better contract, because to keep saying the same thing, but for it not to be changed by the government, we're not buying ourselves time, are we, with these restrictions?
No, we're not. The problem we've got, and this is the way Parliament works, I will definitely make that point in the House of Commons today, and I'll put that point to Matt Hancock. No question, I'll make that point. But in the end, if we voted against his restrictions, and don't forget there are Tory MPs who don't think we should have any restrictions, if we defeated the government in the House of Commons today, there would be no restrictions. And I don't believe that is the best place to be.
OK, but what about on a specific one? Take the 10 p.m. curfew, which by any yardstick, looking at it, has been a total fiasco. What it's done is driven vast numbers of people out onto the street at exactly the same moment, and we're seeing the scenes playing out all over the country, which clearly makes it less safe than it was when they were inside the places they stream out of. On that, do you agree with the 10 p.m. curfew, personally?
Well, again, and you're going to get irritated with my answer, but the way in which the parliamentary vote comes is that we've kind of got, you can either scrap it completely, and I don't think that's the right approach.
Why?
Because
but see, look, you say it's irritating. It's only irritating because it makes no sense to me. Most Labour people we speak to don't agree with the 10 p.m. curfew, and yet you won't vote against it. And at what point does your role as opposition move from just saying you're all useless and everything's wrong to actually, on this specific policy, we believe it's a danger to public health and we are going to vote against it? Because it doesn't make sense. Because
I think what they should do is do what they've done in Wales, which is have a drinking up time and ban the off-sale of drink after 10 o'clock. So Wales have implemented this, and they've not got the big problems that we've got in England of everyone piling out the pub at the same time, piling onto public transport, or piling into the Tesco Express, stocking up on cans or bottles and going back to flats. They've not, so they have a 10 p.m. rule, but they've just been cleverer and smarter in the way they've implemented it. And the government should do that in England. I think the principle of trying to reduce the hours when people can drink, there's logic to that, because we all know that when people have had a drink, your inhibitions fall away and social mixing breaks down. And this virus spreads because of social mixing. And we've got to do everything we can to reduce social mixing as we head into the winter.
You appeared on one of our rival shows this morning, and you said this about Matt Hancock.
When I come on here and I criticise Matt Hancock, he's the Health Secretary, as you know, and Boris Johnson, I don't do it because...
I know him very well.
I don't do it
He's often sat where you are.
Is he? He doesn't go on all the TV shows, does he?
Not my problem.
No.
Certainly not Kay Burley's problem, and good luck to her. A very good show she does. But interesting point you raised there, isn't it? We're in the second wave of the worst health crisis this country has faced for 100 years, and it's now day 168 of the government boycott, which means the Health Secretary has not appeared on this programme since April. Is that not just a dereliction of duty? David Dimble was on earlier agreeing with me that it was. What do you view this as?
I think he's running scared from you and Susanna. And look, you give us a tough time, you're giving me a tough time. Sometimes I come off the show and people on Twitter say, Piers has made you look like a right wally and all that, well, even ruder words and all that type of stuff. But us as politicians have a privileged platform, and we have to be held to account. The British public expect it. And yes, you ask us tough questions. We try our best to answer them. The public will judge whether we've answered them in a satisfactory way or not. But we shouldn't be running away from you. We shouldn't be running scared from you. And I tell you something else. So many people stop me in the street for coming on your show, Piers and Susanna, and they love it. And and actually, a lot of the time I find they've kind of forgotten, the to and fro and the argument. They just love the fact that you're prepared to try and answer your questions and interact with you both, and the public expect that. And I just think it's sort of cowardly that he doesn't come on.
I really appreciate you saying that. What I would say is, if you can't face me and Susanna giving you a tough time in the middle of a pandemic, how can we expect you to run a pandemic? I mean, it just defies belief that they're so cowardly and gutless, but it does explain the mismanagement of the crisis. Anyway, Jonathan Ashworth, it's great always to see you. Thank you. We appreciate it.
Yeah. Go and hold the government to account.
Yeah.
I mean, you've got the power in the House of Commons. You say that the procedure means you're not able to do it, but if you don't agree with the measures, you've got to be able to say that to the government
Get stuck
and do
into them.
something about it.
Get stuck into them.
I'll definitely say it. I'll get stuck into them for you.
All right. Thank you very much indeed. We appreciate it.